Vericiguat for the treatment of patients following a worsening heart failure event. Imagine a 72-year-old patient with HFrEF. He has been clinically stable since his first heart failure hospitalisation at diagnosis, but worsening symptoms have led him to be hospitalised for a second time. As his disease progresses, this patient is at increased risk of developing worsening heart failure events, even when on background therapy. Each worsening heart failure event has a major impact on the risk of death or rehospitalisation for patients with HFrEF. After the initial worsening heart failure event, the time between subsequent heart failure hospitalisations reduces with each event. It is therefore essential to optimise therapy following a worsening heart failure event, to delay or prevent further events, and this can be done through adjusting existing therapies or initiating novel therapies. Patients on quadruple therapy remain at risk of worsening heart failure and cardiovascular death, highlighting the need for alternative therapy options for patients with HFrEF. The HFrEF treatment landscape has evolved over the years to target multiple pathways implicated in heart failure. The soluble guanylate cyclase stimulator, Vericiguat, restores an impaired pathway involved in heart failure pathogenesis and provides a complementary treatment approach alongside background therapy. The Victoria trial investigated the efficacy and safety of Vericiguat in a high-risk patient population. Treatment with Vericiguat significantly reduced the risk of heart failure hospitalisation or cardiovascular death in patients with a recent worsening heart failure event versus placebo. This translates into a number needed to treat of 24 over 1 year. Various sub-analyses of Victoria data have demonstrated that Vericiguat has a favourable safety profile when added to background therapy. It is a well-tolerated treatment that may be suitable for a wide range of patients, including those at risk of hypotension, those at risk of hyperkalemia, and those with renal impairment. Based on the Victoria data, Vericiguat is the first pharmacological therapy to be specifically recommended in international heart failure guidelines for the comprehensive medical treatment of patients following a worsening heart failure event, alongside other guideline-directed medical therapies. Evidence of the benefit of Vericiguat in the Victoria trial will be complemented by the ongoing Victor trial, with results expected in 2025. Victor will investigate the effect of Vericiguat in patients with HFrEF without a recent worsening event. Together, these data may demonstrate that Vericiguat can provide benefit across the full patient trajectory for HFrEF.